Hello, welcome to Focus on Hernando. I'm Brenda Frazier, and on today's show we're talking about HPH Hospice and all of the services that they provide in the county, which are many. But today specifically we're talking about a We Honor Veterans program, which is a program that basically involves HPH Hospice social workers and volunteers providing unique services to the veterans in our community. And here to talk about the program today are Carla Hayes, who is
Brenda.
Community Relations Coordinator for HPH Hospice. Welcome, Carla.
Thank you.
And Judy Streveler, who is a social worker for Hospice. Welcome, Judy.
Good morning.
And John Conroy, who is a volunteer and a veteran.
Yes. Hi, Brenda.
Welcome. Thanks for being here, all of you. We've just been talking for a few minutes just in general about this program, and it sounds like a really unique and wonderful program that you've brought here to the community. Carla, let's start off though by talking just in general terms about hospice and about the services that you provide here in Hernando.
Sure, Brenda. HPH Hospice, we are in 3 counties. We're in Pasco, Hernando, and Citrus. And one of the myths about hospices is that we are all the same. And what I like to go out and talk to people about is that we are not all the same. HPH Hospice, again, is in a tri-county area, Pasco, Hernando, and Citrus counties, and we are a non-for-profit hospice. There are for-profit agencies. We are a non-for-profit. And what that means, it's very important to our patients and our customers, is that because of the fact that we are a non-for-profit, you will never receive a bill from hospice. We bill Medicare, Medicaid, private insurance, and then whatever is non-reimbursable is then subsidized by our foundation. Mm-hmm. So someone makes a donation to hospice or has a fundraiser for hospice, those dollars go into our foundation and they help to subsidize patient care. So I think that's very important to know. Most hospices all have the same ideals and values, but there are some differences. And again, we are very proud of the fact that we can offer those services to our patients and their families.
Okay. And likely most people know what hospice is, but there might be a few out there that don't know what it is. Can you just tell us in general terms, what services does hospice provide?
Well, when you get hospice services, and again, there's some specific criteria that needs to be met before someone is qualifies, if you will, for hospice care. Typically, they have to receive a diagnosis of a life-limiting illness with a prognosis of 6 months or less to live, if that diagnosis takes its general course. Of course, there's recertifications based on, does the patient continue to need our care? Are they still declining? I mean, we're treating the symptoms of the patient, not necessarily we're not treating the disease. So those qualifications need to be met. Your physician needs to write an order, and then you'll be eligible for hospice care. And we're taking care of, again, we have Judy with us, who's a social worker. We provide this interdisciplinary team of physicians, nurses, social workers, bereavement counselors, chaplains, home health aides. You get this volunteers, you get this whole team of people that come in and take care of not only the patient's needs, but they help to take care of the family's needs as well.
Okay, and the services are provided not only in homes, mostly in homes, right? But
the majority of our patients, we believe in the healing of home.
Right.
And most of our, we have, 700 patients on a regular basis in our census. Mm-hmm. So obviously the majority of the care does take place in the patient's home. Mm-hmm. But again, it's wherever that patient calls home. Are they in a nursing home, an assisted living facility? Then that's where hospice care will take place.
So it's a very holistic approach.
Absolutely.
As you said, there's a lot of people involved in providing care to each individual, and you work very closely with the hospitals and nursing homes and facilities.
Absolutely.
Okay.
Yes.
Well, Judy, let's talk a little bit more specifically about the Veterans Program. First of all, how long have you been with hospice as a social worker?
I've been with hospice since the spring of 1993.
Wow.
And it's been a privilege for me. I have serviced patients in both Pasco and Hernando counties, and I've always been a social worker, but I have worn several other hats. I've helped with volunteer training, some of the hospital liaison work, but I've always been a social worker.
Okay, tell us about the Veterans Program and how you're involved with that and how it all got started.
It started, about 6 to 8 months ago, we had our first seminar, the social workers that we were talked to by VA, and truthfully, until that time, I had never really thought about the impact that one's military service could have on end-of-life care and issues that occur many, many years later. I have had patients, it's made me much more aware of them, that have been in all branches of the military. And partnering with We Honor Veterans gives me information and tools that I can use to help in counseling and end-of-life care and meeting that veteran's needs. The VA provides us with guidelines and information that help me to open up discussions and questions and topics that would be of interest to veterans once I determine what particular branch of the military or when they served. On initial assessment, when I go out and meet patients and after I introduce myself and kind of talk about hospice, one of the questions that I begin with is, have you served in the military? Have family members served in the military? And what branch? And then there's more specific questions that I can ask.
Okay. All right. So that's basically the difference between then when you interacted with these patients before and now that you have the Veterans Program, is that you're able to ask more specific questions and interact with them on a more specific basis based on their experiences.
Yes, and it's really given me the tools and made me much more aware of that. Since we started the program, I have learned now that I've had patients in every branch of the military, from Merchant Marines and the Coast Guard, National Guard, maybe areas of the military that we don't think of as often. I've had patients that have moved from active care, active duty in the military and then progressed on to become civilian contractors. Afterwards, in various areas of the military, in NASA. So, and every time that I talk to a veteran and they share some of their memorabilia with me or talk about their wartime experiences, I do not want to miss an opportunity to help support that veteran's needs emotionally.
Okay, so I wanted to ask you, why is it important? And you kind of answered it there. Why is it important that when an individual who is a veteran is at the end of their life and you know they have a limited amount of time left and hospice comes in, why is it important that they're able to connect with them specifically on that basis?
I think for some of the veterans, just again, a recognition for what they have done. Sometimes we just think about them on Memorial Day and the 4th of July. Some of our older veterans and older patients, depending on where they are residing, just do not have a lot of people to talk about. Also, the aging process, even for healthier people, we tend to live and think more about events that happened in the past. And sometimes veterans are hashing over events that might not have been as pleasant. When the social worker can go in and talk to them, it's not a family member. I'm not trying to specifically obtain any information to them. I am not a threat to them. I'm not asking for finances. I am just there to listen. And from the medical standpoint with the nurses too, it helps us to know. We've had a patient that was a prisoner in an Italian prison camp, and he was reliving trying to escape through icy water and hallucinating. So
it's very helpful to understand what he's gone through.